Hey, it's Meredith back again, here to talk to you more about spirometry, why the numbers are important, kind of what they mean, and then a little bit about the flow volume loop. All right, so to review, the FEV1, if you recall, is essentially the volume that you breathe out in the first second that you're blowing out, okay? The FVC, that force vital capacity, that's actually going to be the total volume that you blow out in the whole breath. So here's a graph. Time is on the x-axis, volume is on the y, and this line is what a regular person blowing out air would look like. So at 1 second, you've breathed out most of your air, and you have still more to go, but it plateaus. Somebody who has obstructive lung disease, airflow limitation, they're going to have a harder time breathing out, and so they're going to breathe out less in that first second. Versus somebody with restrictive disease who's actually going to blow out maybe more in that first second, but overall they have lower volumes. All right, so I tried to draw these myself, but it was really hard. So here I go. Pay attention to the axes. The volume actually goes outside in, which is a little counterintuitive. And the y-axis, the bottom is inspiration and the top is actually expiration. So that's very important for these graphs, okay? In the middle, there's a normal flow volume loop. And so you can sort of see that the person is going to breathe out really hard, hit their peak expiratory flow, and then they're going to keep blowing, keep blowing, keep blowing, keep blowing until they get all the way to their smallest volume, and then they're going to take a big deep breath back in, and that's how the maneuver is done. On the left side of the diagram, it shows the obstructive curve, and so they try to breathe out in 1 second as much as they can, but they hit their peak expiratory flow a lot earlier. And so then when they're keep blowing, keep blowing, keep blowing, their flow is less per unit volume every step of the way compared to a normal person. All right, so on this side, you have the restrictive loop. And so the main thing to notice here is that it's a lot smaller overall, and it's shifted to the right. And this is because the volumes are a lot smaller. So notice here it's going only up to 4, whereas the normal curve has gone up to 6. So let's take a closer look at the normal curve, all right? So here is at the end of your forced vital capacity breath. And if you look below, you can see that that whole volume from a little bit below 2 to 6 is that vital capacity, okay? You'll also notice that they have the residual volume, the RV, and the TLC listed here. These are both measured in the body box by plethysmography, which is how you measure the volumes that we'll talk about in the next talk. At the top of the curve is the peak expiratory flow, so that's important to note. And then a number that's right in the middle is the FEF 50, and you guys talked about that today in lecture. One thing important to note is that the FEV1 is not on this graph, and that's because the FEV1 is a measure in time, and as you'll know, neither of these axes have time. So that's just something I want you guys to be aware of. So by the numbers, so they talk a lot about FEV1, right? So FEV1 should be reduced in airflow limitation. When we say airflow limitation, we mean things like asthma, COPD, something that's sort of tightening the airways, making it harder for air to get out, okay? For FVC, that forced vital capacity, that's usually normal in these sort of obstructive airflow limitation diseases. And so that's important to remember. Volumes are not actually measured on spirometry, and that is important and confusing because we just talked a lot about volumes, but the important thing to remember is that these volumes in spirometry are per unit time. And so technically our flows, they're not the total volumes that are in your body. Those are going to be measured by plethysmography, also known as the body box. So if your FEV1 is low, and we said your FVC would probably be normal, this is in a case of asthma or COPD, then your FEV1 to FVC ratio will be low, right? So this ratio essentially is the hallmark of airflow limitation, which is what is suggestive of obstructive lung diseases like asthma and COPD. And so these are the main numbers that I want you to remember from this lecture. All right, so in summary, 1, spirometry measures flows. So therefore it's used to diagnose airflow limitations. Number 2, remember, different disease states will have different flows per unit volume. And so that's important to remember too. Number 3, patients with obstructive lung disease will have trouble breathing out. And that's the whole point. That's what you measure on spirometry. So that's all I got. Next up, we're going to talk about lung volumes. After that, we'll get to DLCO, and then if we have time next week, we can do some practice cases. I hope you found this helpful. Please feel free to email me, mkgreer@emory.edu. Good luck studying.